Hello everyone. Today I will introduce to you the neurodevelopmental disorder. But first I will introduce you the my co-reporters Musripasi Muhammad by Monasati Kamandan and Mahatma Sankala, yours truly. Now, the neurodevelopmental disorder term is refers to the disorder on the functioning of our neurological system, the brain, that affects our emotion, learning ability, self-control, and memory. So, neuro, neuro means brain. It is where the disorder, this disorder, it is where the disorder is found. The impairment in the functionality of our neurological system. While the development here is the critical stage. That means the our childhood. That's the critical state of our mind because it is new to the world. So like an empty shell. Next, children with neurodevelopmental disorders can experience difficulties with language, speech, motor skills, behavior, memory, learning, or other neurological function. So tama yun siya dahil nga doon sa developmental natin, doon sa critical stage ng ating childhood kung saan may na-develop, there are things found in our neurological system. There are problems in here that supports, that contributes a lot pala. Yes, the contributes to the development of our disorders. These symptoms and behaviors experienced by the child often change or evolve as childs grow older. And yes, some of the disabilities are permanent, and it can be found in three causes. The first one is genetic disorder. In genetic disorder, we take example of Down syndrome, where there is an extra chromosome on the child's 21st chromosome. Diba? Tatlo yung chromosome niya dun sa pang 20th na chromosome. So basically, dahil nga genetic ito, this is hereditary impairment. And the next cause is biological problem, kung saan uh, ito yung in between sa genetic mismo, and then yung environmental factors. These biological problems arise in for example, a mother smokes during her pregnancy. This can result to many possible defects on the unborn child's health, and also the appearance, such as the cleft lip, oh yes, cleft lip, poor lungs, and other physical or internal dysfunctioning. So that's a disability also and a disorder. And the next cause is the environmental factors, such as the social deprivation, language deprivation, and trauma. So we take example in the trauma. Example in the trauma is when an accident happened during your childhood, which give impairments such as the loss of hearing, loss of eyesight, and other physical disabilities. The next one is this type of disorder will be explained by my co-reporter, but I will introduce it to you the types of disorder as introduction for their topic. The first one is intellectual disorders. The second, communication disorder, autism spectrum disorder, attention deficit hyperactivity disorder, and specific learning disorder. Next is diagnosis and treatments. So this part also will be explained by my co-reporters, but here's an insight. There are no currently known cure for developmental neurodevelopmental disorders, but psychosocial treatments, behavioral treatments, cognitive, And other like family oriented strategies can give positive response to these disorders. So to give you a fact, in neurodevelopmental disorder, the most common disorder is autism spectrum disorder or ASD, and attention deficit and hyperactivity disorder or ADHD. Ito yung pinaka-highest rating na na-record sa under neurodevelopmental disorder. So, alam natin na masyadong mabilis ang pag-explain ko. So, I will give you the salient points here. Ito ang summary ng pag-report ko for the introduction of neurodevelopmental disorder. So, first one is neurodevelopmental disorders are disabilities associated primarily with the functioning of a neurological system, the brain. And second salient point here is neurodevelopmental disorders can be permanent. From childhood to your death, you can have it. And the third one is there are no currently known cure for neurodevelopmental disorders unless yung mga nabanggit kanina na intervention. But we hope na merong mahanap na cure para dito. Thank you very much for your listening. Arigatou gozaimasu.
Hello everyone, I am Musrifa Si Muhammad and today I am going to discuss the different disorder under the neurodevelopmental. So to begin with, the Diagnostic and Statistical Manual of Mental Disorder in the 5th edition, or in short for DSM-5, categorized the following disorders under the neurodevelopmental condition. So we have here 5 different disorder under the neurodevelopmental, and these are intellectual disorder, communication disorder, autism spectrum disorder or the ASD, attention deficit hyperactivity disorder or the ADHD, and the specific learning disorder. So kung mapapansin nyo, 5 lang yung nilagay ko out of many disorder in the under the neurodevelopmental. It is because these 5 are the most common na makikita natin sa isang bata or sa tao, especially the ASD and the ADHD. So let us first know what is intellectual disorder. So the intellectual disorder is also known for intellectual disability because it is preferred by the advocates and researchers, especially in the most English-speaking countries. So anyways, let's define what is intellectual disorder. Intellectual disability is a disorder marked by below average intellectual function and a lack of skills necessary for independent daily living. The conditions begins in the developmental period. It is said that the intellectual disability is defined by an intelligent quotient or IQ score below 70 in addition to deficit in 2 or more adaptive behaviors that affect an individual's everyday life. However, a person with unusually low IQ may not necessarily be considered intellectually disabled because it now also addresses both mental functioning and functional skills. So moving forward, the general abilities that are examined to diagnose intellectual disability include the reasoning, problem solving, thinking, abstract, planning, judgment, learning from instruction and experience, and the practical understanding. So these abilities are measured using individually administered of intelligence by trained clinicians. So the other behavioral traits associated with intellectual disability but not deemed criteria for a diagnosis include aggression, dependency, impulsivity, gullibility, passivity, self-injury, stubbornness, low self-esteem, low frustration tolerance, and high risk of suicide. It is common for people with intellectual disabilities to have a co-occurring mental, neurodevelopmental, medical, and physical condition. So if a genetic condition has caused the intellectual disability, the person may have other impairments as well. So according to DSM-5, intellectual disability affects about 1% of the population, and the prevalence of severe intellectual disability is approximately 1,000 people. Deviation in normal adaptive behaviors depend on the severity of the condition. So we have here two conditions, which is the mild and the severe. So in mild intellectual disability, it is associated with academic difficulties and a somewhat concrete approach to solving problems. While the severe intellectual disability, it is associated with limited communication and the need for support with all activities of daily living. The causes of intellectual disability can be roughly broken down into several categories, and these are genetic abnormalities and inherited metabolic disorders. We also have seizure disorders, the nutritional deficits such as severe malnutrition, environmental influences like alcohol, drugs, toxins such as lead and mercury. So next is the communication disorder. So it is defined as a group of neurodevelopmental conditions that involve persistent problems related to language and speech. They most commonly occur in children but can persist into adulthood. It is estimated that nearly 1 in 10 American children has some type of communication disorder. A communication disorder is a developmental condition that impacts a person's ability to participate in social settings, develop relationship, and performs well at school or work. This means that a person has difficulty with speech, communication, language, or some combinations of those. We have here two main elements of language competence, and these are the production and the comprehension. So in the production, it is ability to translate one's thoughts into words and phrases, while the competence is the ability to understand what other may say. The following are the most common symptoms of communication disorder. However, each child may experience symptoms differently. So, young children with communication disorders may not speak at all or may have a limited vocabulary for their age. Some children with communication disorders have difficulty understanding simple direction or are unable to name objects. So, remember that marami pang ibang symptoms na masasabing may isang communication disorder ang isang bata or ang isang tao. But these are just an example. So, the communication disorders may be developmental or acquired. So, the cause may be related to biological problems such as abnormalities of brain development or possible by exposure to toxins during pregnancy, such as abused substances or environmental toxins such as lead. So, it can be a genetic factor, sometimes considered a contributing cause in some cases. So next is the autism spectrum disorder or the ASD. It is a neurological and developmental disorder that affects how people interact with others, communicate, learn, and behave. Although autism can be diagnosed at any age, it is described as a developmental disorder because symptoms generally appears in the first 2 years of life. By the way, the word developmental here does not mean that the people will outgrow the problem as they develop from children to adults. It does mean that the problem emerges early in development. Individuals who have an autism spectrum have trouble interacting with other people, knowing the rules for social conversation in social situations, but then they also have language difficulty that interfere with their ability to perform in those situations. And also the behavioral things that go along with it, like resistance to changes, obsessive interest, sensory sensitivities, and the like. So, autism is known as spectrum disorder because there is a wide variation in the type and severity of symptoms people will experience. Recently, experts talk about the different types of autism, such as autistic disorder, Asperger's syndrome, pervasive developmental disorder, not otherwise specified PDD-NOS, and childhood disintegration disorder. But now, they are all called autism spectrum disorder. People with ASD have difficulty with social communication and interaction, restricted interest, and repetitive behaviors. So, under the social communication and interaction behaviors may include making little or inconsistent eye contact, appearing not to look at or listen to people who are talking, infrequently sharing interests, emotion, or enjoyment of object or activities. Under the restricted and repetitive behaviors may include repeating certain behaviors or having unusual behaviors such as repeating words or phrases or a behavior called echolalia or having a lasting intense interest in specific topics such as numbers, details, or facts. People on the autism spectrum may also have many strengths, including being able to learn things in details and remember information for long periods of time, being strong visual and auditory learners, excelling in math, science, music, or arts. According to the researchers, they don't know the primary causes of ASD, but studies suggest that a person's genes can act together with aspects of their environment to affect development in ways that lead to ASD. Some factors that are associated with an increased likelihood of developing ASD include having a sibling with ASD, having older parents, having certain genetic conditions such as Down syndrome or Fragile X syndrome, having a very low birth weight. Next is the ADHD or Attention Deficit Hyperactivity Disorder. It is a chronic condition that affects millions of children and often continues into adulthood. ADHD includes a combination of persistent problems such as difficulty sustaining attention, hyperactivity, and impulsive behavior. So ADHD is neurodevelopmental disorder or defined by American Psychiatric Association in the DSM-5, and it is currently diagnosed in both children and adults based on the symptoms of inattention and hyperactivity or impulsivity. So children with ASD may also struggle with low self-esteem, troubled relationship, and poor performance in school. Symptoms sometimes lessen with age. However, some people never completely outgrow their ADHD symptoms, but they can learn strategies to be successful. ADHD sometimes starts before age 12, and in some children, they are noticeable as early as 3 years of age. ADHD occurs more often in males than in females, and behaviors can be different in boys and girls. For example, boys may be more hyperactive and girls may tend to be quietly inattentive. There are three subtypes of ADHD, and these are predominantly inattentive, predominantly hyperactive or impulsivity, and combined. Causes of ADHD can be in genes or it tends to run in family. Chemicals, which is the brain chemicals in people with ADHD may be out of balance. Brain changes, which is areas of the brain that control attention are less active in children with ADHD. Poor nutrition, infections, smoking, drinking, substance abuse during pregnancy. These things can affect a baby's brain development. And last is the toxins and brain injury or a brain disorder. Last is the specific learning disorder. Learning disabilities are due to genetic or neurobiological factors that alter brain functioning in a manner which affects one or more cognitive processes related to learning. It is said that specific learning disorder is a classification of disorders in which a person has difficulty learning in a typical manner within one several domains. It is also categorized by inadequate development of specific academic, language, and speech skills. More so, these processing problems can interfere with learning basic skills such as reading, writing, or math. They can also interfere with higher level skills such as organization, time planning, abstract, reasoning, long or short term memory, and attention. It is important to realize that learning disabilities can affect an individual's life beyond academics and can impact relationship with family, friends, and in the workplace. Generally speaking, people with learning disabilities are of average or above average intelligence. There often appears to be a gap between the individual's potential and actual achievement. This is why learning disabilities are referred to as hidden disorders because the person looks perfectly normal and it seems to be very bright and intelligent person, yet may be unable to demonstrate the skills level expected from someone similar age. There are types of learning disabilities. These are dyscalculia, which is a specific learning disability that affects a person's ability to understand numbers and learn math facts. We also have dysgraphia that affects a person's handwriting ability and fine motor skills. And the dyslexia affects reading and related language-based processing skills. And the nonverbal learning disabilities, which is has trouble interpreting nonverbal cues like facial expressions or body language and may have poor coordination. Factors that could cause a learning disability can be in heredity, which is it is observed that a child whose parents have had a learning disability is likely to develop the same disorder. It can also be illness during and after birth. This may cause learning disabilities. Stress during infancy, which is a stressful incident after birth, such as high fever, head injury, or poor nutrition. We can also have environment, which increase exposure to toxins such as lead. I think that's the end of my report. Thank you for listening or for watching. Hope you learned something. Just always remember, symptoms persist, consult your doctor.
Intellectual disability is a lifelong condition. Although there is currently no cure, most people can learn to improve their functioning over time. Receiving early, ongoing intervention can often improve functioning, thereby allowing someone to thrive. Most treatment plans for intellectual disability focuses on the person's strength, needs, support needed to function, and lastly, additional condition. Many services exist to help people with intellectual disability and for their family to get the support they need. Most of these services allow someone with intellectual disability to function normally in society. Someone's diagnosis typically determines which services and protections of right, such as special education, or home, or community services, they are eligible to receive under federal law or national law. It also usually helps determine which supportive services they may need. Supportive services include early interventions that work to identify intellectual disability in infants and toddlers, special education and academic support such as individual education plans which are available in the US under federal law for free to every child with intellectual disability. Next, transition services that help people with intellectual disability transition to adulthood after school. Next, vocational programs such as job coaching or or skill learning. So, marami pang sample dito ng services sa screen. Pwede niyo lang siyang basahin. So, family members, caregivers, friends, co-workers, and community members can also provide additional support to people with intellectual disability. With proper support and treatment, most people with intellectual disability are capable of achieving successful productions role in their communities. So, however, how well someone is able to cope and function with intellectual disability is also dependent on the severity of their condition and any other underlying genetics or medical condition they have. No cure exists for autism spectrum disorder. and there is no one size fits all treatment. So the goal of treatment is to maximize your child's ability to function by reducing autism spectrum disorder symptoms and supporting development and learning. Early intervention during the preschool years can help your child learn critical social, communication, functional, and behavioral skills. So the range of home-based and school-based treatment and intervention for autism spectrum disorder can be overwhelming, and your child's needs may change over time. So your healthcare provider can recommend options and to help identify resources in your area. So if your child is diagnosed with autism spectrum disorder, talk to expert about creating a treatment strategy and build a team of professionals to meet your child's needs. So the treatment option may include behavior and communication therapy. So in behavior and communication therapies, many programs address the range of social, language, and behavioral difficulties associated with autism spectrum disorders. Some programs focus on reducing problem behaviors and teaching new skills. Other programs focus on teaching children how to act in social situations or communicate better with others. So, applied behavioral analysis can help children learn new skills and generalize these skills to multiple situations through a reward-based motivation system. So, next is educational therapy. So, in educational therapies, children with autism spectrum disorder often respond well to highly structured educational programs. So, successful programs typically include a team of specialists and a variety of activities to improve social skills, communication, and behavior. So, preschool children who receive intensive individualized behavioral interventions often shows good progress. Next is family therapy. So in family therapies, parents and other family members can learn how to play and interact with their children in ways that promote social interaction skills, manage problem behaviors, and teach daily living skills and communication. So next is other therapy. So in other therapies, depending on your child's needs, speech therapy to improve communication skills, occupational therapy to teach activities of daily living, and physical therapy to improve movement and balance may be beneficial. So, psychologists can recommend ways to address problem behavior. So, next is medication. So, no medication can improve the core signs of autism spectrum disorder, but specific medication can help control symptoms. For example, certain medication may be prescribed if your child is hyperactive. Anti Antipsychotic drugs are sometimes used to treat severe behavior problems, and antidepressants may be prescribed for anxiety. Keep all healthcare provides updated on any medications or supplements your child is taking. Some medications and supplements can interact, causing dangerous side effects. Now, let's talk about managing other medical and mental health problems. So, in addition to autism spectrum disorder, children, teens, and adults can also experience medical health issues. So, children with autism spectrum disorder may also have medical issues such as epilepsy, sleep disorders, limited food preference, and stomach problems. So, ask your child's doctor how to best manage this condition together. So, next, let's talk about the problems with transition to adulthood. So, teens and young adults with autism spectrum disorder may have difficulty understanding body changes. Also, social situations become increasingly complex in adolescence, and there may be less tolerance for individual differences. Behavior problems may be challenging during the teens years. So, next is other mental health disorders. So, Teens and adults with autism spectrum disorder often experience other mental health disorders such as anxiety and depression. Your doctor, mental health professional, and community advocacy and services organization can offer help. Treatment recommendation for ADHD. So, for children with ADHD younger than 6 years of age, it recommends parents training in behavior management as the first line of treatment before medication is tried. So, for children 6 years of age and older, the recommendations include medical and behavior therapy together. Training in behavior management for children up to age of 12 and other types of behavior therapy and training for adolescents. So school can be part of the treatment as well. Recommendation also include adding behavioral classroom intervention and school support. Good treatment plans will include close monitoring of whether how much the treatment helps the child behavior, as well as making changes as needed along the way. Behavior therapy, including training for parents. So, ADHD affects not only a child's ability to pay attention or sit still at school, it also affects relationship with family and other children. So, children with ADHD often shows behavior that can be very disruptive to others. Behavior therapy is a treatment option that can help reduce this behavior. It is often helpful to start behavior therapy as soon as diagnosis is made. So, the goal of behavioral therapy are to learn or strengthen positive behaviors and eliminate unwanted or problems behavior. Behavior therapy for ADHD can include parents training in behavior management, behavior therapy with children, and behavioral intervention in the classroom. So these are approaches can also be used together. For children who attended early child programs, it is usually most effective if parents and educators work together to help the child. So now let's talk about the medication. So in medication can help children manage their ADHD symptoms in their everyday life and can help them control the behaviors that cause difficulties with family, friends, and at school. So several different types of medication are FDA approved to treat ADHD in children as young as 6 years of age. So first is stimulants. So stimulants are the best known and most widely used ADHD medication. Between 70 to 80% of children with ADHD have fewer ADHD symptoms when taking this fast-acting medication. So next is non-stimulants. So non-stimulants were approved for the treatment of ADHD in 2003. They do not work as quickly as stimulants, but their effect can last up to 24 hours. So medication can affect children differently and can have side effects such as decreased appetite or sleep problems. One child may respond well to the one medication but not to others. So healthcare provides who prescribes medication may need to try different medication and doses. It recommends that healthcare providers observe and adjust the dose of medication to find the right balance between benefits and side effects. It is important for parents to work with their child's healthcare providers to find the medication that works best for their child. People with learning disabilities and disorders can learn strategies for coping with their disabilities. Getting help earlier increases the likelihood for success in school and later in life. If learning disabilities remain untreated, a child may begin to feel frustrated with schoolwork, which can lead to low self-esteem, depression, and other problems. So, usually, experts work to help a child learn skills by building on the child's strength and developing ways to compensate for the child's weaknesses. Interventions vary depending on the nature and extent of the disability. Special education services. So, children diagnosed with learning and other disabilities in most states, territories, and provinces can generally qualify for special educational services. Educational laws typically require that children with specific learning disorder be given the same opportunities that children without the disorder have. So, in most locations, children became eligible for such services in preschool or in the first year of formal schooling, since research has shown that the early intervention can be the key. Intervention for specific learning disabilities. So, here are these few examples of ways educators help children with specific learning disabilities. So, for the children that have specific language disorder with impairment in reading, so special teaching techniques. So this can include helping a child learn through multisensory experiences and by providing immediate feedback to strengthen a child's ability to recognize words. So next is classroom modification. So for example, teacher can give students that need it extra time to finish tasks and provide recorded tests that allow the child to hear the question instead of reading them. So next is use of technology. So children with impairment in reading may benefit from listening to books or tape or using word processing programs with special check features. So next is full children that have specific language disorder with impairment in written expression. So special tools can be used. So teacher can offer oral exam, provide a note taker, and or allow the children to videotape report instead of writing them. So next is use of technology. So a child can be taught to use word processing programs or audio recorder instead of writing hand. So next is other way of reducing the need of writing. So teacher can provide notes, outlines, and pre-printed study sheets. So next is for children that have specific language disorder with impairment in mathematics. So visual techniques can be used. For example, children can draw pictures of word problem and show the student how to use colored pencils to differentiate parts of problems. So next is use of memory aid. Rhymes and music are among the techniques that can be used to help a child remember math concepts. So next is use of computers. So a child can use a computer for math drills and practice. So here are the other treatments. So a child with specific learning disorder may struggle with low self-esteem, frustration, and other problems. So mental health professionals, including schools counselor or psychologists, can help the child understand these feelings.